Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. Today we are going to talk about breeding soundness examination, a step-by-step approach to diagnosing mare infertility. For this type of examination, we want to make sure we have all kind of background information, a history of the mare, because the older mares we know have lower conception rate. We want to make sure that we know enough about the prior breeding. Is she a maiden mare, which means that she has not been bred, or is she a barren mare, means that this mare did not have a foal last year, or if she was bred, did she foal, or how many foals she has had. Then we will be talking about asking questions about her cycle. We know the estrous cycle during breeding season could be from 18 to 24 days. And how did they determine that if a mare was in heat when they bred her? Did they use a stallion to tease her? And then we know that if there are shortened estrous cycles, means less than 18 days or so, then we know that there could be some problems, potential, some infection of the uterus or inflammation of the uterus, or it could be a longer than normal estrous cycle length. There could be indication of early embryonic death. Then after that, we would like to have our own visual and other examination of the mare. We want to look at the mare, what kind of body condition she is in, because we have a scoring system, body condition score, which goes from 1 to 9. Usually mares with 5 or more body condition score are the mares which are, good fertile mares. So the healthy mares are the ones which not only get pregnant but also carry the foal to full term. So cursory examination of the mare would be important, even though our focus is primarily on reproduction. But we should make a note if, let us say, you see a running diarrhea or something, we need to make a note of that. But then common tests, as we know, that if it's required, then we could have a urine test, blood test of some kind, a fecal examination. All those tests are at our disposal. Then how we are going to put all this information? Well, we have a very well worked out breeding soundness examination form. There are so many different forms that I have seen, but this one is really the one which I like it quite a bit. And this is from Dr. Briscoe's book, which I have given information of the complete reference at the end. So as you can see on this form, if you look at the left-hand side, we have information about the mare, and then we have information about the owner, and then on the right-hand side, you see the general examination. And as I mentioned, we are going to, examine all those areas of reproductive tract, and we'll note the findings of it. And then it's a lab test, which we do as a part of the reproductive examination. And those are primarily endometrial culture, endometrial biopsy, and then we come up with diagnosis. So the mare restraint is very important, as you saw in previous slides too, but here you could see that this mare is in, horse stocks. Her tail is wrapped around and then it's, tied up there. And this mare has a tail which is also wrapped but also tied around her neck, which works very well too. Then we would like to look at the external genitalia. This conformation of vulva, perineum, and anus properly placed is very important because these labia should be well opposed. If there is any, distance between them, there is an opening, and then you may have some contaminations and things like that. So this will be the ideal way to see how the mare would be. Now, from that ideal one, you come to this one. You see this mare how what we would call sunken anus. Anus has gone inside. So what they have done is it has pulled that vulvar area up and it's all open. So this kind of situation you would expect if you see this thing in something like this poor body condition with the mare in this way. I think you could expect something is going on there. It could be a urine pooling. It could be pneumovagina. So those conditions could be there, but I think this visualization of this reproductive area, perineal area, would give you some indication what you might be expecting. Now the safety, again, I just cannot emphasize enough. These animals are pretty powerful. So we want to make sure there are some nice barriers. As you can see on the left-hand side all the way, there's a solid barrier, what you call kickboard, which is all padded. And even if mare tries to kick, it would not hurt the operator or herself. And then in the middle, you could see the rope is behind the mare, which is, if you know the mare, their personality, I think that works very well too. This is a few-year-old mice slide, which I'm doing the ultrasonography on this mare. But on the extreme right side, you see our student from Louisiana State University is on the farm, and there's no facilities of any kind. So he is smart enough to stay on the side and try to palpate mare in that way. Now, what you're expecting when we are doing palpation per rectum, we are already aware of the T-shaped uterus, and we will go and do complete examination of the both horns and also feel the ovaries. We know in a breeding season, those follicles could be very large in size, and they also enlarge the whole ovary. But then you could have other abnormalities too. And I just put in this slide for you for granulosa cell tumor of the ovary. We will have a different, video on the abnormalities of the ovaries and reproductive tract in the future. Then once you have that finding of the uterus, and you can see on the right-hand side, this is what we are expecting, a T-shaped uterus. But we really want to make sure that we also feel if there are any contents in the uterus. This picture happened to be from Lori on-site information website from Dr. Lofsted from Prince Edward Island Veterinary College in Canada. And he's shown by opening that, making a window in the uterus to show you the pyometra or mucopooling material in the uterus. Then, as I mentioned, anything goes inside the vagina or the uterus, it has to be all clean outside and then sterilized. So we have here, you can see a speculum which this person is putting in, and then with the light trying to visualize the cervix. Now for visualizing cervix and doing all the different things, I think this list from, again, Dr. Brinsko's book does a very good job. So if you look at on the top there, there's a gauze to rip the tail, and after that you see stainless steel alligator uterine biopsy forceps, which are very important and they work very well. So I highly recommend those of you who are going to be in equine reproduction working with the mares, please have these equipments with you. Then after that, you see the tube of the lubricant. Now this is a sterile lubricant, and we want to make sure that we do not use any other lubricant until we are sure it's sterile. Then after that, you have a culture swab, which is a guarded, double guarded swab. After that is the unguarded swab, just for your information. Then is a metal speculum that which could go in the cervix with the help of light. Then you can look at it. Again, even the sterile sleeve is needed to get inside the vagina and try to examine that. Now, if we want to really have a good visualization of the vagina and the cervix, one is better off to have these Caslix type specula. As you can see on the top is what you call, three-pronged speculum. At the bottom is a two-pronged double blade speculum. They work very well. And again, they need to be closed and put in lubricant very well, and then you put inside. Once you are inside the vagina, then you try to open it up. And then, as you can see, I don't know if you can appreciate in this slide, which shows cervix on the top. If you look at the straight, at the bottom is the pool of the urine. So these are the findings that you will see on examination. Then comes to the culture of the uterus, and that is for trying to find if there is any bacteria there. So this is again nicely done to show the reproductive tract and the opening in that, and then see how the culturate goes in, and then how you swab it, against the endometrium, and then take that culture out and make a slide out of it. The top one, which is probably, I would say, the most important test of the breeding soundness examination, is the uterine biopsy. Why the biopsy is so important? Because it has been worked out very well. And the system which most of us use is introduced by late Professor Dr. Robert Kenny from University of Pennsylvania. I was fortunate enough to spend some time in his lab, and very, very impressive gentleman. It has contributed a lot. So anyway, so as you can see, it has worked out so well that if you have category 1 biopsy, these are the mares which have 80 to 100% chance to get pregnant and then carry foal to full term. Then we have category 2A, 2B, and then 3. As you can see, percentages of it. Category 3 is the one the mares have less than 10% chance of getting pregnant and carry foal to full term. So what we are taking biopsy from? Well, we are aware the endometrial glands are there in the uterus. So we'll be taking a piece of the endometrium to try to then have it fixed, and then put it on the slide and evaluate it. Now, what we'll be looking at? Well, as you can see here, category 1 on your left-hand side, it has got very nicely uniform these glands. And there is almost no, inflammation there. If there is any, maybe very small areas. Then here is category 2A. And if you look a little more closely and even compare these two slides, you will see the difference. So this is 2A, and then we come to the 2B. There's a big difference there, because this animal has only about 10 to 50% chance of getting pregnant. And then this category 3, less than 10% chance of getting pregnant. You could see there's no organizations of endometrial glands here. And again, these are some of the things really you have to do it over and over again. And look at these slides. In fact, even as a theriogenologist, we have been highly recommended by our trainers, our professors, our teachers, that we should learn how to evaluate by ourselves. So I think with some time, we all start learning when we do it over and over. I understand that the tissue has to go to a pathology lab. They are going to fix it. They probably will give you the information too, but I think it's a good idea that us should have also competence to try to evaluate that, because then you have all the information. Our respectful pathologists do not have that information in front of them. They may have written information you have provided, but your own observations are also very valuable, which you can put together with the final results. These references I have mentioned here are very valuable. The top one is Dr. Brinsko and his co-workers have done outstanding good job with the Manual of Equine Reproduction, which I have also, taken some of the slides, and other 2 books are also worth to have on your shelf if you're going to do an equine reproduction work. With that, I'm going to stop. and invite your questions and comments to put it on my YouTube channel, and I'll be happy to answer those. Until then, I wish you well. Bye bye.